All right, 7:14, everybody. The metro area is in the midst of what some are calling a tridemic, RSV, the flu, COVID. All three viruses making things miserable, filling up some hospitals.
In our area, NYU Langone and Brooklyn and Woodhull Hospital reported no intensive care beds being available. The same with several hospitals in Westchester. Senator Chuck Schumer is calling for the federal government to be ready to help out as soon as help is needed.
Yeah, so this is important to so many around our area. So here to tell us what exactly is going on, Dr. Arun Chopra of NYU Langone's Hassenfeld Children's Hospital right here in Manhattan. So, Doctor, good morning to you. Welcome back to the Pick Up Morning News.
Good morning.
So let's get into this, right? Because you hear the word tridemic and you immediately, your ears perk up and you're like, here we go. So how bad are you seeing things, RSV, flu, COVID? Is this a bit of a crisis for you? What are you seeing in your hospital?
So we're busy. Everybody, I think, is busy around the area. We've seen a lot of RSV, thankfully, and hopefully, fingers crossed, RSV is actually starting to taper off a little bit and slow down a little bit. But unfortunately, we are seeing flu really picking up both in the community and in hospitalization. So most of the children we're admitting now with respiratory illness are flu more than RSV. And so we are seeing flu pick up. And so we may dodge all three peaking at the same time, but it's going to be a very long, very busy winter for all of the hospitals in the area, I think.
Thankfully, these RSV cases are dwindling, but we've been hearing so much, of course, about RSV. Doctor, what is RSV? What are the symptoms, and how is this virus transmitted?
Yeah, so respiratory syncytial virus, which is the RSV, is a virus that attacks the respiratory lining. It tends to be really a disease of children, young children, although anybody can get it. For older adults, it's generally just a cold. For younger children, they can get sicker with increased work of breathing, needing more oxygen, and occasionally needing extra support like a ventilator as well. And there are some kids that are more at risk. Children who have lung disease, children that are premature, and children that are very young.
So how do you know as a parent, right, what's going on with your kid between RSV and, say, the flu, which you're seeing an uptick of? Are the symptoms, because their symptoms seem to be similar?
So they're similar. The difference with the flu that you see is it tends to be more fever, body aches, chills, muscle pain that you don't really get with RSV. So those would be the signs that maybe this is the flu. A different virus causing you to get sick. Unlike RSV, the flu actually does have some options for treatment.
Right.
And so if you catch it early, within the first 48 hours, you can take oseltamivir or Tamiflu, and that can shorten your illness a little bit. The other thing I should say, and would be remiss to not mention, is that if you haven't already, you should get your flu shot.
Yes.
We're running out of time, but it does take a week or two to work. But we are starting to see flu cases spike. And so if you haven't gotten your flu shot, now is totally the time to do that.
Absolutely. And doctor, as we talk about this tridemic, what's kind of caused this confluence of these three viruses here all at once?
Well, some of it is that the winter months is when these viruses tend to pick up anyway. And the timing of them has been really, I think, disrupted by the COVID pandemic and our response to it. And so with us going into lockdown in 2020, we really saw no viral activity. We saw no RSV, we saw no flu. And so the latent immunity is probably a little bit lower right now. There's probably more people that are more sensitive to RSV, which has allowed it to kick up and be sort of a bigger effect. And some years it's worse than others. And then I think the same thing with the flu.
Yeah.
They do sort of come close to each other. We're lucky this year that they seem to be just slightly off and maybe we'll be sort of okay. But as you said at the opening, all of the hospitals are very full. We get a lot of patients coming in.
Right.
And we are operating really in surge status most of the time.
So we're almost out of time here. So I just want to, because you seem to be, you're all doctors that we've had on seem to be in agreement of what causes RSV and everything else. What seems to be a little bit of a differentiation is whether or not there's really a tridemic happening, right? So you're seeing RSV come down at your specific hospital, but what are your counterparts saying at other area hospitals? Is it coming down at the same time, or is it just in your specific location?
So what we're seeing in the New York area is that RSV rates across the state are starting to fall, look like they've peaked and maybe are starting to come down. I say that with a little bit of hesitation because sometimes you get a double peak or they come back up again. And we are definitely seeing flu cases across the region increase. And so it looks like those things may be slightly offset. I know that at the beginning of the season, we were worried that, in fact, we were going to see this prolonged RSV that's going to overlap with flu. That's not to say that this isn't a problem. I think we are seeing a lot of RSV this year, and we're on track to see a lot of flu, and that's going to keep the hospitals very, very.
All right, Dr. Chopra from NYU Langone's Hassenfeld Children's Hospital, thank you so much for your time this morning.
Thanks for having me.
All right, thank you.